Understanding diabetes, blood glucose, blood pressure, temperature, and pH according to the Yin-Yang theory, Part 68. Purpose. Search the accuracy of current treatments from both Western and Eastern medicines aiming to prevent diseases and avoid the cases of misdiagnosed treatments sometimes encountered in Western medicine. A. Notion of yin-yang in Oriental medicine. A good doctor must base himself on the four fundamental principles of diagnosis and the yin-yang nature of the disease to conduct a treatment. According to the specific protocol of Oriental medicine, if the doctor treats according to the person and number 39's statements, it would be a symptomatic treatment, possibly aggravating the disease. In energetic transformations, yin and yang must coexist harmoniously. If one aspect is lacking, the other would be predominant and will cause the disease. There is a saying in Oriental medicine, if the disease is in yin, treat with yang, weakened yin, yang becomes dominant and will cause the disease. If the disease is yang, treat with yin, weakened yang, yin becomes dominant and will cause the disease. That is why the doctor must know the yin or yang nature of the disease. Yin-yang classification. Yang viscera energy, X's functions back of hand, yin organs, blood deficiency structures, palm and yin. There is yang. The function of the organs represents yang and yin. It ensures the energetic transformations of all five elements. The structure of the organs represents yin and yin. It ensures the function of maintaining, protecting, nourishing and growing within the organ. In yang, there is yin. The structure of the viscera represents yin and yang. It ensures the function of maintaining, protecting, nourishing and growth within the viscera. The function of the viscera represents the yang in the yang. It ensures the energetic transformations of all the five elements. If the temperature is lukewarm and is the same on the back and palm of the hand, the yin and the yang are in balance. If the temperature is hot, higher than normal, on the back and palm of the hand, it is because the yin and yang are in excess. If the temperature is low, lower than normal, on the back and palm of the hand, it means that the yin and yang are insufficient. If the temperature at the palm of the hand is warm, higher than normal, while the temperature at the back of the hand remains normal but lower than the temperature at the palm, the yin vacuum is causing internal heat. The body temperature is warm, but the person likes to cover up and drink hot drinks. If the temperature on the back of the hand is low below normal, and lower than the temperature on the palm, it is the yang vacuum that causes the internal cold. If the yang in the yin is deficient, it is the decrease in the function of containing liquids, water, blood, sweat. The body will lose water through perspiration, causing fatigue and weakness. The saying of Oriental medicine says, yang deficiency causes spontaneous sweating. The following criteria can be used to determine the yin or yang nature of the disease. Yin nature, illness inside the body, insufficiency, cold. Chronicity, fear of cold, weakness, fatigue, craving for hot drinks. Nature yang, disease on the surface, excess, heat, acute, body heat, desire for coolness and cold drinks. B. Explanation of yin-yang by the tensiometer, glucometer, thermometer, pH paper. The proper functioning of the billions of cells in the body helps to maintain overall good health. The four ingredients necessary for cells are glucose, protein, lipid, and oxygen. Our state of health is reflected in our body weight and blood pressure monitor readings. Qigong therapy, complementary medicine, has established the correlation table between blood pressure and age. Groups: 5 to 12 age years, systolic 95 to 100, diastolic 60 to 120 mmHg, 60 to 120 bpm equals beats per minute. 13 to 17 age years, systolic 100 to 110, diastolic 60 to 65 mmHg, 60 to minus 65 bpm 18 to 40 age years. Systolic 110 to 120, diastolic 65 to 70 mmHg. 65 minus 70 bpm 41 to 59 age years. Systolic 120 to 130, diastolic 70 to 80 mmHg. 70 to 75 bpm 60 age years and plus. Systolic 130 to 140, diastolic 80 to 90 mmHg. 70-80 bpm blood glucose levels according to WHO, World Health Organization, in 1979 are: before meals, 100 to 140 milligrams per deciliter. After meal, 140 to 200 milligrams per deciliter. The tensions of a person aged 18 to 40 years are used as a reference to explain the diseases according to yin-yang. Systolic 110 to 120 millimeters of mercury. Diastolic 65 to 70 millimeters of mercury. Pulse 65 to 70 bpm 1. The systolic represents the energy, yang. In Oriental medicine, the maximum value is 120 millimeters of mercury. Oriental medicine calls extreme yang. If more than 120 millimeters of mercury, it is excess yang. The minimum value is 110 millimeters of mercury. Oriental medicine calls small yang. If less than 120 millimeters of mercury, it is deficiency of yang. 2. The diastolic represents blood, yin in Oriental medicine. The maximum value is 70 millimeters of mercury. It is extreme yin. If more than 70 millimeters of mercury, it becomes excess yin. The minimum value is 65 millimeters of mercury. It is small yin. If less than 65 millimeters of mercury, it does mean insufficient yin. 3. Example of excess yang. Excess yin. The tensions of a person aged 60 and over serve as a reference in this case study. Systolic 130 to 140 millimeters of mercury. Diastolic 80 to 90 millimeters of mercury. Pulse 70 to 80 bpm for the person 60 years of age and older. If the maximum yang energy, systolic, value is 140 millimeters of mercury, and the maximum yin blood, diastolic, value is 90 millimeters of mercury, then that person does not have high blood pressure, as there is no yang or yin excess. According to Western medicine, hypertension occurs when the systolic exceeds 140 millimeters of mercury. Yang excess gives a superficial pulse, i.e. a pulse that is noticeable on the surface of the artery, and yin excess gives a wide pulse because the artery is well filled with excess blood. If a young person has the same blood pressure as an elderly person, then that young person has hypertension, because there is excess yang and excess yin relative to his age. Hypertension occurs when there is yang-yin excess, even if the systolic is less than 140 millimeters of mercury. This is why children who have the tensions of a teenager have hypertension and often bleed from the nose by rupturing the nasal capillaries. 4. Insufficient yang case and insufficient yin case. The tensions of a child and an adult serve as a reference for this case study. Child, 5 to 12 years. 95 to 100 millimeters of mercury, 60 to 65 millimeters of mercury, 60 to 120 bpm. Adult, 41 to 59 years, 120 to 130 millimeters of mercury, 70 to 80 millimeters of mercury, 70 to 75 bpm. If an adult person has small yang, systolic, less than 120 millimeters of mercury, or equal to a children's systolic, then that person is suffering from yang deficiency. There would not be enough energy to ensure good blood circulation, causing the body to feel cold, difficult to breathe, easy sweating, low and weak heartbeat. Taking a pulse in Oriental medicine gives a deep pulse detectable in the depth of the artery. If an adult has the small yin, diastolic, less than 70 millimeters of mercury, or equal to a children diastolic, then that person suffers from insufficient yin. There would not be enough blood in the bloodstream, causing warmth to the heart, chest. But the temperature remains low, anxiety. Taking the pulse gives an empty pulse. Oriental medicine can detect various illnesses, not detectable in Western medicine, in the following combinations: excess yang, superficial pulse, insufficient yang, deep pulse; excess yin, ample pulse, insufficient yin, empty pulse; excess yang and yin, insufficient yang and yin, excess yang and insufficient yin, excess yin and insufficient yang in the treatment of hypertension and diabetes. When there is no more yang excess and yin excess, hypertension. When there is no more hyperglycemia, diabetes. Always continuing the medication will make an excess more and more insufficient and thus lower the arterial tensions that could cause cancer. Knowing that hypotension and hypoglycemia will give birth to other diseases, and by continuing the medication, it is lending a hand to the monetary gains of the pharmaceutical industry controlled by powerful industrial tycoons like Money Talk. Blood pressure values according to the stages of cancer progression: stage 1 to 95, 65 millimeters of mercury, not yet detectable in Western medicine; stage 2 to 90, 60 millimeters of mercury, not yet detectable in Western medicine; step 3, 80-85 55 60 millimeters of mercury, cancer installed; step 4 to 75-80 50 55 millimeters of mercury, cancer installed; final stage 70 to 75 50 to 54 millimeters of mercury. At this stage, the blood F2O3 formula has no oxygen, but contains only iron. As in cases of blood cancer, the diastolic of 45 to 50 millimeters of mercury means the loss of blood, leading to muscle wasting, weight loss. No matter the treatment methods in Eastern or Western medicine, as long as they increase weight, blood pressure, blood sugar, are appropriate treatments. If the cancer worsens from stage 1 to stage 2, treatment should be stopped. Western medicine tends to complete all the planned steps, chemo-radiotherapy, even if there is an aggravation leading to death, and sorry, we did our best. 5. The heartbeat represents the cold and warm states in Oriental medicine. The number of beats per minute varies by age group. Children 5 to 12 years, 60 to 120 bpm; teenagers 13 to 17 years, 65 bpm; young adults 18 to 40 years, 65 to 70 bpm; adults 41 to 59 years, 70 to 75 bpm; aged 60 and over, 70 to 80 bpm. Few people know that the pulse in children is different from that of adults. At rest, 60 bpm, and during activities, 120 bpm. This temporary high pulse does not mean an infection. This is why adults who babysit and play with children get tired quickly, but not children. The average pulse rate is 70 to 80 beats per minute, minimum 70, maximum 80. A pulse below 70 bpm makes the body cold, a temperature below 36 C°, and a slow, retarded pulse. A pulse above 80 bpm gives warmth to the body. A temperature above 36.5 C° and an accelerated, rapid pulse. 6. Internal cold, external cold. Internal heat is measured by the salivary pH. The more the pH tends towards acidity, i.e., pH 6 and below, the colder and more acidic the blood becomes. An acidic environment favors the development of cancerous cells. External heat is measured by the non-contact thermometer. A temperature of 36 C° and less indicates a slight cold, less than 35 C° the thermometer displays low. A temperature of 37 C° and above indicates a state of heat. Over 40 C° indicates fever. 7. Cold disguised as heat. Heat disguised as cold or chronic diseases that are difficult to treat. The low pulse of 65 bpm indicates cold. But the temperature measured at the skin is above 37 C°. According to Oriental medicine, it is cold disguised as heat. The high pulsation of 90 to 120 bpm indicates a state of heat. But the temperature measured on the skin is 35 C° or lower or low. It is heat disguised as cold according to Eastern medicine. 8. Blood glucose levels. Do temperature, degree, cold or heat always cause illness in Oriental medicine? Excessive thirst and glycosuria are acute cases. There is no such thing as chronic diabetes. Acute cases are the three excesses: excessive thirst, excessive urination, and excessive hunger. The person eats a lot but always remains thin, due to the lack of food processing and absorption. Incorrect treatment would lead to malnutrition, physical deterioration, heart failure, and death. Without knowing the nature of the diseases, yin-yang, excess insufficiency, cold heat. The treatment can make an excess more and more in excess, and an insufficiency more and more in insufficiency, leading to death. An appropriate treatment brings back the tensions and the temperature to normal values. When there are no more states, heat, cold, insufficiency, excess, the treatment is stopped. On the other hand, Western medicine continues the use of anti-diabetic drugs, making insufficiency more and more insufficiency. Differentiation of diabetic cases. A. Non-diabetic case. Tensions are the tensions corresponding to the age groups. Pulse, 70 to 80 bpm. Temperature, 36 to 36.5 C°. pH 7. Blood glucose, before meals, 100 to 140 mg per deciliter. After meal, 140 to 180 mg per deciliter. The two following cases are non-diabetic. Tensions are those corresponding to the age groups. Pulse, 70 to 80 bpm. Temperature, 36 to 36.5 C°. pH 7. Blood sugar levels after a meal, either 120 mg per deciliter or 300 mg per deciliter. These blood sugar levels do not indicate either a lack or excess of sugar, but mean that the body organizes the transformations according to the needs of the moment, to always maintain the balance yin-yang, cold, heat, excess, inadequacy. The disturbances of the yin-yang, cold, heat, excess, and deficit balance are described below. B. Hypoglycemia, not identified as diabetic. For fear of being diabetic, the person avoids sugar. Therefore the blood sugar is low, 120 mg per deciliter. The pulse would be low. Consequently, the temperature is low and the pH is acidic. pH 5, i.e. the blood is acidic and the blood sugar content is insufficient. This condition gives indigestion, esophageal reflux, increased liver enzymes. C. Case A, not diabetic, but identified as diabetic. In Western medicine, long-term use of anti-diabetic drugs will cause low blood glucose levels of less than 120 mg per deciliter. High pulse rate 110 bpm, low temperature, low pH, acidic pH. Apart from glucose, which is a young functional sugar, sugars from other sources, food, rice, vegetables, will lead to acetonemia and liver cancer. The cause is the drop in blood sugar value, indicating diabetes, which makes an entire population diabetic. D. Hyperglycemia, a blood glucose level of 300 mg per deciliter and a pulse rate of 90 bpm indicate internal heat. A temperature of 37.5 C° indicates external heat. A pH 8 means that yang generates internal heat, which will generate the acute states, excessive thirst and excessive urination. It is enough to stop consuming glucose for a certain period of time. To decrease heat, pulsation, drinking sugarcane juice to hydrate and compensate for the thirst. The glycemia will go down without any medication. For fear of diabetes, one avoids sugar. The body has no more sugar, why take in addition medicines to lower the sugar? Blood sugar levels resulting from yin sugars are the cause of cellular degeneration and leg amputation. The amputation is a consequence of diabetes treatment with continuous insulin injections. But the blood sugar level is still high at 300 mg per deciliter and the pulse is low at 60 bpm. The low pulsation indicates internal cold, therefore the blood becomes denser, hindering blood flow. The temperature is low and the pH is acidic. A cold, acidic blood, without oxygen or sugar is no longer nourishing. It is the cause of cell death, insensibility of the feet and amputation. We should ask ourselves why blood sugar levels are high by 300 mg per deciliter and more. When we do not consume glucose, and at the same time, we receive insulin injections. The explanations of Western medicine are much more misleading. Sugars come from food, fruits, vegetables, causing the decrease and restriction of the diet, which further weakens the sugar intake and health. Before the appearance of the glucometer, there is no disease called diabetes. Eating habits were normal and diversified. The glucometer encourages the notion of sugar content, hyperglycemia, hence the appearance of strict or varied diets, and the appearance of high blood sugar levels of 300 mg per deciliter and more. The glucometer gives the global value of non-functional yin sugars, sucroses, and functional yang sugar, glucose. We are therefore all fooled by the interpretation of the glucometer values, leading to unnecessary medication. Glucose has the chemical formula C6H12O6. The molar mass of glucose is obtained by adding together the atomic molar masses of the constituent elements. Atomic molar mass of carbon, C12. Atomic molecular weight of hydrogen, H1. Atomic molar mass of oxygen, O16. Molar mass of glucose, 180 grams mole. 6 by 12 plus 12 by 1 plus 6 by 16 equals 180 grams mole. This means that 180 grams of glucose contains N Avogadro glucose molecules. N 6.02 x 1023 is the Avogadro ampere number. In other words, 180 grams of glucose contains 6.02 x 1023 glucose molecules. Explicitly, 180 grams of glucose contains 602 trillion billion glucose molecules. Glucose molar mass, 180 grams mole equals 180 milligrams per millimole or 180 milligrams per liter equals 18 milligrams per deciliter. The measured blood glucose level of 300 milligrams per deciliter means a blood glucose level of 16.7 mmol L glucose. Because glucose has been consumed, to determine the glucose-related blood glucose, the measured blood glucose is divided by the molecular weight of the glucose. 300 divided by 18 equals 16.7. Any food without glucose provides only the sucroses whose chemical formula is C12H22011 of molar mass, 342 grams m. 12 by 12 plus 22 by 1 plus 11 by 16 equals 342 grams mole or 342 milligrams per millimole or 342 milligrams per liter or 34.2 milligrams per deciliter. A blood glucose level of 300 milligrams per deciliter means a blood glucose level of 8.8 mmol L in glucose. Same reasoning as above, since only sucrose is consumed. The blood glucose level measured is divided by the molar mass of the sucrose, i.e. 300 divided by 34.2 equals 8.8. Even after a meal, this blood glucose level does not indicate diabetes, but means that the body lacks enough glucose to complete digestion. You should drink glucose and do the roll-on exercise to turn food into energy. Blood glucose levels will drop. Regardless of blood glucose levels or treatment methods, there is no diabetes as long as there is balance yin-yang, systolic, energy blood, diastolic, heat-cold, pulse. Temperature measured from 35 to 36.5 degrees Celsius and pH 7 to pH 7.5. In Oriental medicine, there is no chronic diabetes. Western medicine has made it chronic, leading to lifelong medication, lending a hand to the monetary gains of industrial tycoons. Only retired physicians dare to say that drug abuse is harmful, implying chemical and intellectual harm. If a drug always aggravates the disease, why not drop it? Just like the teaching of the Buddha, give up in order to better restructure yourself mentally and physiologically. C. Differentiation of yin and yang on the basis of the 4 diagnostic principles. Observe. Yin sign. Face. Pale, greenish or dark obscure color. Mental. Inert, without vitality. Tongue. White color, smooth lingual coating. Body. Fatigue, weakness, heaviness, crouchiness. Diseases, chronicity, insufficiency, cold, internalization, inhibition of exchanges. Western medicine gives different names according to the presence or absence of bacteria, viruses, etc. Yang sign, face, pink or red. Mental, restlessness, excitement, madness. Tongue, red, dry yellow or dark yellow coating. More serious is the chapping of the tongue. Coating becomes thorny. Blackish. Body, warmth, anger, seeks coolness. Diseases, acute, excess, heat, exteriorization, excess exchanges. Western medicine gives different names according to the presence or absence of bacteria, viruses. Listen. Yin sign. Voice. Weak, speaks little, doesn't like to talk. Breathing. Short, weak. Yang sign. Voice. Loud, noisy, likes to talk, talk nonsense, shouting, insulting. Breathing. Strong. Noisy, fast, mucousy. Question. Yin sign. Stool, pasty, foul-smelling urine, frequent urination of clear urine in small quantities. Food, eats little, does not taste the flavors. Beverages, not thirsty, likes hot drinks. Yang sign. Stools, hard, dry, strong odors. Urine, short-term urination of colored urine. Diet, dry mouth, does not like to eat. Beverages, search for cold drinks. Taking the pulse. Yin sign. By the fingers. Pulse. Deep, slow, weak, small without strength. Palpation. Cold body, frozen limbs, likes massages. B by tensiometer, glucometer, thermometer, pH paper. The deep pulse indicates yang deficiency. The measured systolic will be less than 100 millimeters of mercury. Slow pulse indicates slow blood flow. The slower the blood flow, the colder the limbs. The hand temperature will be less than 32 degrees Celsius or low. The heart rate would be 60 to 65 beats per minute. The small pulse without strength indicates lack of blood. The measured diastolic will be less than 60 millimeters of mercury. Blood glucose would be less than 100 milligrams per deciliter. If the blood pressure is less than 100 millimeters of mercury, 60 millimeters of mercury, 60 to 65 bpm, and the blood glucose is less than 100 milligrams per deciliter, also if the pH is 6 or less, this indicates that the blood is acidic. Yang sign. By the fingers. Pulse. Shallow, fast, strong, ample, full with force. Palpation. Warm body and limbs, sensitive abdomen, does not like massages. B by tensiometer, glucometer, thermometer. pH paper. The strong superficial pulse will give the high diastolic 170 to 240 millimeters of mercury. The broad, ample pulse will give the diastolic from 75 millimeters of mercury to 85 millimeters of mercury. The fast pulse indicates heat. The temperature will be 39 degrees Celsius to 41 degrees Celsius. Pulse rate of 100 to 120 bpm indicates an infection. Blood glucose would be 300 to 500 milligrams per deciliter. Confirmation of yin or yang states by salivary pH paper. A healthy person, pH range values are 7 to 7.5, pulling towards alkalinity, temperature 36 to 36.5 degrees Celsius, pulse 70 to 80 bpm, body and limbs are neither hot nor cold. The pH 3 to 4 of the stomach is very acidic to digest and transform food into blood of pH 7 to 7.5. If the blood pH is acidic, then there would be cold. The values of systolic, diastolic, pulse, temperature, glycemia will all be low, reflecting a yin state that promotes the development of cancer. There are several ways to raise the pH to an alkaline pH. Meditative breathing. Qigong therapy exercises. These exercises also raise body heat, systolic, blood sugar, acidic pH to alkaline pH. Blood-forming foods would be well indicated. If the pH is raised only by drinking Kangen water, without practicing meditative breathing or Qigong therapy exercises, without eating blood-forming foods, then the pH in the stomach would be less acidic, thus impeding digestion. D. Cases often encountered in Oriental medicine. Yin blocking, 001. Cause, attack of the perverse wind. Blood in the depths of the body by heat causing disturbances of the yin-yang energy transformations, blood energy, revealed by the systolic and diastolic, causing coma, teeth grinding. Clenching of fingers, mucus obstructing the throat. Western medicine calls these states coma, jaw locking, clenched fists, abundant mucus. Yang blocking, 002. The signs are similar to those of the yin blockage case, with the additional sign of yin injured by yang. Heat to the blood inside the body, and heat to the energy on the surface. Western medicine names: hypertension, hyperglycemia, fever. Toxic yin and yang, 003. It is a serious case due to the proliferation of pathogens, bacteria, viruses, in the blood. These agents are incubated for a long time in the throat, giving two situations. Toxic yang. Appearance of patches on the face, throat pain, vomiting of blood and pus. Due to the accumulation of toxic heat in the upper part of the body. There is no temperature rise in the limbs. Toxic yin. Eyes and face have a blackish coloration. Pain to the whole body as if beaten up, cold in the limbs. Western medicine has distinguished two manifestations of this bacterial or viral attack, including coronavirus. Fever, sore throat, difficulty breathing, it's toxic yang, alternating fever and chills, this is toxic yin. To find out if the toxicity is due to yin or yang, simply observe the measurements of systolic, diastolic, pulse, blood sugar, temperature, pH, if they are too high or too low. It is enough to restore them according to the three principles: alimentation, energy, mental. Everything will return to normal. Yin-yang interaction, 004. This is a severe case due to the early treatment of fever, making you sweat immediately without knowing the root cause. The fluid loss allows the perverse yang to attack and weaken the yin energy, giving the inability to eat. The person will make incoherent statements. E.g., vaccine A is for fever. Vaccine B is for fever and chills. The vaccination error could be fatal. Western medicine does not have these notions to guide the manufacture of vaccines. The notion of vaccine does not exist in Oriental medicine. It is enough to bring the systolic, diastolic, pulse, temperature, glycemia, pH to the values corresponding to the age groups. There is no more disease. Yin deficiency, 005. This is the case when food is not transformed into nourishing blood. Lack of yin blood causes dry mouth, constipation, dark urine, red lips. Warmth to the palms of the hands, soles of the feet and body in the late evening. Signs of lack of blood in different organs are liver, head pain, dizziness, tinnitus, numbness, tremors. Poor vision at the end of the day, red tongue, thin tongue coating. Heart, emotionalism, forgetfulness, insomnia, red tongue, thin lingual coating. Lungs, cough with viscous mucus with blood spots, red cheekbones, slight fever in the evening, dry mouth, night sweats, poor sleep quality, red tongue, thin tongue coating. Kidneys, lumbar and knee pain, tinnitus, spermatorum, leakage of semen outside of ejaculation, frequent forgetfulness, red tongue, thin lingual coating. Yang deficiency, 006. It is the lack of oxygen, energy, glucose, lack of blood propelling force, lack of yang energy of the heart, spleen, kidneys, low systolic giving pallor to the face and lips. Frequent urination of clear urine, soft stools, smooth and white lingual coating. Blood glucose and blood pressure meter readings are all low. Yang deficiency, yin excess, 007. The right arm and right leg measurements give low systolic but high diastolic. The pulse is low due to lack of glucose, yang sugar, and excess sucrose, yin sugar. Giving cold in the body and on the surface, frequent urination, cold sweat. Insufficient yang kidneys, therefore, decrease the energetic transformations of the organs and viscera. Not producing body heat, causing cold in the body and limbs, diarrhea, edema. Yang and yin deficiency, 008. The three values, systolic, diastolic and pulse are low. It is the lack of glucose, yang sugar, and excess sucrose, yin sugar, giving low temperature, acid pH, poor nutrition, weight loss. It is a serious disease. The injured yin will affect the yang and vice versa, or both deficiencies are expressed at the same time, giving signs of yang emptiness and yin emptiness. Heat at yang and yin, 009. The lack of blood gives internal heat by wanting to release heat through perspiration, moxibustion or sauna. An external heat has been created in addition. The combination of two heat sources will exhaust the body's fluids and blood. The case is due to the treatment error, aggravating the disease. Yin deficiency, apparent yang dominance, 010. The lack of blood and body fluids weakens the yin, inducing the apparent dominance of yang. 5 yin and 5 yang equals balance. Yin drops to 2, yang is not in excess, but remains stable at 5. The 3 yang in addition to yin is the apparent dominance giving episodic outbreaks of heat, red and dry lingual coating, red cheeks, spontaneous sweating, heat to palms and soles of feet. Coughing with blood, weight loss, insomnia, angry temperament, anxious, seminal loss. Yin deficiency with mucus and throat ulcer, 011. Yin kidney failure, lets the fire escape upwards, injuring the lungs, giving ulceration to the mucous membrane of the throat. Difficult and painful swallowing, internal heat, temperature rises in the evening, signs often encountered in pulmonary tuberculosis. Lack of blood leads to low diastolic blood pressure in the right arm, lack of oxygen and blood to the lungs, leading to tuberculosis or lung cancer, with precursor signs of throat ulceration and cough. In this case, 3 consecutive elements are in insufficiency: earth, Stomach rate. The poor diet does not allow the production of blood and liquids to feed the throat, the lungs, metal, which will lack oxygen to maintain stable blood iron 3 oxide formula. In order to feed water, kidneys, thus putting them in insufficiency. The water of the kidneys is insufficient to moisten the throat and compensate for the fire of the heart, giving internal heat. Dryness of bones and skin, loss of weight and strength. Yin heat, 012. Signs. On the right, diastolic pressure is low, but pulse is high, due to chronic lack of blood, not high sugar content. In chronic cases, the lack of yin gives a slight temperature, gradually reducing health. In acute cases, there would be high heat and fever. Insufficient yin gives internal heat, 013. Yin deficiency gives internal heat, intermittent flares of temperature especially at night, night sweats, warmth to palms and soles of feet, dry mouth, dry and red tongue. Yang is also deficient. Due to lack of glucose, promotes spontaneous sweating, which will increase blood and fluid loss, further decreasing yin and diastolic on the right. This case is mostly found in people under lifetime medication for diabetes and hypertension. Hypertension and diabetes are cases of excess in Oriental medicine. The treatment is stopped when there is no more excess. Western medicine allows social habits and industrial monetary profits to impose lifelong medication. Insufficient yang gives morning warmth, 014. The weakness of the earth, stomach rate, lets the heat escape outside, especially in the morning, with signs of spontaneous sweating, weakness. Lack of appetite, the person does not like to talk. Insufficient yang gives external cold, 015. Yang deficiency is due to the lack of energy, or lack of fire at the gateway of life, 4Vg. Not allowing the energetic transformations of organs and viscera, there is no food transformation into defensive energy and nourishing energy. The decrease in energy and blood circulation gives signs of cold to the limbs and the body on the surface. Fear of cold, pale face, the person is easily cold. The low systolic and low pulse rate 60 to 65 bpm indicate a lack of glucose. When glucose is not consumed, the measured blood glucose level of 200 mg per deciliter is that of sucrose, yin sugar, from foods, rice, fruits, vegetables. To find out if blood glucose is related to glucose, divide the measured blood glucose level of 200 mg per deciliter by the molar mass of sucrose, which is 34.2 mg per deciliter. i.e., 200 divided by 34.2 equals 5.8 mmol in glucose. This low blood glucose level of 5.8 mg per deciliter, which translates into a low pulse rate of 60 to 65 bpm, does not indicate diabetes. Insulin does not change blood glucose into sucrose. As long as you do not consume glucose, and you are still receiving insulin injections, your blood glucose would always remain high. Insulin will draw glucose from muscles, bones, marrow, heart, brain, creating in turn several cancerous areas, detected as generalized metastasis. To remedy this situation, it was necessary to take glucose to raise the blood glucose level to 8 mmol/L, in other words, to have a blood glucose gain of plus 8 mmol/L. If no glucose is taken, the blood glucose level will decrease more and more to become negative as minus 8 mmol/L. Yin deficiency gives heat and dryness to the lungs, 016. Yin deficiency gives internal heat. The insufficient yin kidneys do not compensate for the fire, which will injure and dry out the lungs, which will lose more and more yin, or become drier and drier, giving signs dry cough. Dry cough with blood in the sputum, throat pain, hoarse breathing, red tongue with thin coating. Cases often encountered in cases of pulmonary tuberculosis. Laryngitis, inflammation inside the throat, bronchiectasis, chronic inflammation of the respiratory tract. Great yin deficiency, dried yin, 017. Great yin deficiency causes deep inhibitions or reversal of transformation, with cold sweat perspiration, as in cases of dizziness, kidney failure. High urinary urea. The cause is to worry, emotional and mental agitation, following cold yin extremes, eventually causing yin-yang dissociation. Diastolic is very high, pulse is very low. Blood sugar is low, less than 80 milligrams per deciliter, indicating lack of glucose, causing dizziness, heart failure, blood acidity. Yin deficiency alters fluid retention, 018. In the right arm, the diastolic is very low. The systolic is also low, meaning the lack of energy, oxygen to keep the iron 3 oxide blood count stable. The blood is no longer stored, retained in the vessels, but leaks outside, giving hemorrhages. Through coughing, nosebleeds, in the urine. The dark brown to black color of extravasated blood signifies the terminal phase of cancers. Yin loss, 019. Yin of the liver and kidneys in insufficiency gives a rapid loss of vision, blurred vision, as in cases of poor nutrition, chronic diseases, acute excessive heat in terminal phase. Diastolic measured at the feet is very low, indicating lack of blood, shriveling of the kidneys and liver. The low systolic in the right arm indicates lack of energy, unable to pump the little blood to the eyes. Yang loss, 020. 2 cases of extreme yang loss. Excessive internal yin cold will injure the yang as well as the mind, giving hallucinations. Blurred visions, incoherent speech, profuse sweating. Signs encountered in cases of chronic inflammation of the kidneys, high urea content in the urine. Excessive yin cold, low pulsation, due to lack of glucose and therefore energy. The vacuum of yang can no longer contain the yin, which will be extravasiated to the outside. Incessant emission of semen after sexual intercourse. Leading to death, it is the death of the rider by the position of the man. Injured yin, 021. Yin from the kidneys and liver is injured due to an infection with moderate rise in temperature. Gives signs, slight rise in body temperature, warm palms and soles of the feet. Weakness, weight loss, sore throat, red cheeks, red tongue with dry coating. Pulsation is high, diastolic is low, less than 60 millimeters of mercury. It is a sign of yin vacuum giving internal heat. In addition, the infection gives temperature on the surface of the skin. If there is internal and external heat and high blood sugar, it is a sign of excess, including excessive thirst. Injured yang, 022. Several factors can injure yang, giving signs, anxiety, fear, insomnia, jumping. Causes of yang impairment. The perverse cold attacks the 3 yin. Overdose of medication in the treatment of heat, sweating, diarrhea, extreme heat, stagnant humidity. Too much joy will disperse the yang. Error in the treatment of cases affected by external factors such as climatic factors, viruses, penetrating to the liver, spleen, kidneys, perverse cold penetrating deep down. Creating an excessive yin and a yang vacuum. The systolic is low and the diastolic is high, means the loss of defensive energy. Overdose of refreshing potions makes yin more and more yin. Empty yang already gives spontaneous sweating. If in addition, we make you sweat in the sauna, there would be loss of more sweat and blood, thus aggravating the disease. Yin depletion. Separation of yang, 023. It is a serious case where there is dissociation of yin and yang, as in heavy bleeding, profuse sweating, incessant diarrhea. There is thus loss of water. Yin depletion causes separation of yang, giving signs, body heat, high fever, incessant sweating and diarrhea, constant mental agitation, panting breathing, warmth in the limbs. Dry red tongue and lips. Search for cold drinks, fresh food. This case is seen in people using antihypertensive and anti-diabetic drugs. To avoid the worst, it is necessary to monitor blood pressure and blood sugar levels regularly. Stop medication when blood pressure drops or blood sugar levels drop, and eat blood-forming foods to raise blood pressure and drink glucose to raise blood sugar levels. Loss of yang, 024. Normally the loss of yin precedes the loss of yang, giving signs such as cold sweat, cold limbs, white face, purple lips, weak breathing. Tension and blood sugar levels should be monitored regularly to avoid a fatal end. Yin stagnation, 025. Defecation is blocked due to cold spleen and kidneys, the person is weak. There is no bloating or abdominal swelling. There is a desire to have a bowel movement, but there is no bowel movement, limbs without warmth, frequent urination of clear urine, colorless tongue. Thin white coating. The spleen does not nourish the lungs, metal. The lungs do not nourish the kidneys, due to the lack of glucose for providing energy to retain water, resulting in frequent urination. The large intestine, metal, loses the force of contraction. The lungs, metal, lose the energy to push the stool out. The accumulation of stool will lead to colon cancer. Yin and edema, 026. Insufficient spleen and kidneys lower the metabolism and circulation of water, giving edema to the legs. The skin is pale white or slightly dark, the mouth is dull, the stools are pasty. It is the sign of chronic insufficiency. Just above the ankle of the foot, the systolic and diastolic are high, but the pulse is low. Lack of glucose gives heart failure. The heart does not provide fire at the gate of life, 4 Vg, so that it can metabolize water. The temperature at the feet is low. People using insulin and consuming glucose, blood glucose level of 300 mg per deciliter means blood glucose level is 16.7 mmol/L. Blood glucose divided by the molar mass of glucose, 18. 300 divided by 18 equals 16.7 mmol/L. For people using insulin and not consuming glucose, a blood glucose level of 300 mg per deciliter means that the blood glucose level is 8.8 mmol/L. Blood glucose divided by molar mass of sucrose, 34.2, because there is no glucose consumption. 300 divided by 34.2 equals 8.8 mmol/L, therefore are not diabetics. The misinterpretation of the glucometer values led to the lifetime medication. Excess yin dissociation of yang, 027. An extreme excess of yin induces yang dissociation, giving a real yin inside the body and a yang apparent on the skin, with signs such as restlessness, anxiety, thirst but does not drink, looks for hot drinks, likes to cover up, likes to wear warm clothes. Lack of glucose gives low systolic, high diastolic, and low pulse, less than 60 bpm, but the skin temperature is 37 degrees Celsius high. This is the sign of cold disguises itself as heat. Yin surplus, yang decline, 028. Excess yin inside the body weakens the yang. Stagnant water hurts the yang. Lack of glucose and the cold nature of food and beverages contribute to yin excess, with the following signs: low systolic, high diastolic, blood sugar pulse and temperature all are low. Yang deficiency and yin excess, 029. The weakness of the yang kidneys does not provide heat to the organs and viscera, resulting in the decrease of the energetic transformations of the organs and viscera, giving cold to the body, limbs, chills, diarrhea, edemas, etc. Excess of yang, 030. The disorder is due to the attack by the perverse heat from the outside, combined with the presence already inside of the heat. The confrontation of the two heat triggers fever. Excess yang and heat to the skin. Yang epileptic, 031. The diseases of heat nature. There are sudden attacks of epileptic seizures with body heat, convulsions, teeth grinding, jaw blockage. Abundant salivation, eye revulsion. Extreme yin and yang leakage, O32. Signs of yin and yang energies seriously injured. Incessant sweating of large drops of sweat the size of pearls, cold limbs. Closed eyes, open mouth, open hands, uncontrolled urination. Similar signs of cerebral vascular accident, CVA, cases, attacked by the perverse wind with abundant sweating, large hemorrhagia. Abundant diarrhea with water, incessant loss of semen, coma with vertigo, great exhaustion undermining the functions of the organs and viscera of the five elements.